Hi, my name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome to the vlog post about a question that it's difficult to answer, but I'll take a stab at it. Someone wrote to me and asked what is the single most important diagnostic test to identify multiple myeloma. And while it's tricky to choose just one single important test, I will stick my neck out and say the bone marrow biopsy or bone marrow aspirate is an important indicator. As we survivors know, bone marrow biopsy is taking a needle and physically sticking it into either your sternum or your hip to suck out some of the marrow. Let's see is there a presence of multiple plasma cells in your marrow? And then, if they are, what percentage, how many of those plasma cells are in there? The reason why that's important is basically a staging issue. If you have, I believe the notion is less than 10%, you are pre-myeloma. If you have greater than, it used to be 30%, but if you have a higher percentage of plasma cells in your marrow, that means your myeloma is more advanced. So you can be stage 1, stage 2, stage 3. All to say, the bone marrow biopsy is a pretty important diagnostic test in your diagnosis as a potential myeloma patient. Two things: stick a needle. There's no way to sample your marrow other than to stick a needle in there and pull some out. Do you have myeloma cells in your marrow? And then, what is the percentage of myeloma cells in your marrow? If you have any questions, comments, there are ways to get rid of those cells. There are ways to live with those cells. What the percentage is, there's a lot to this business of plasma cells in your marrow. If you have questions, comments, send me an email, let me know. I look forward to working with you. Thank you for your time. Be well.